This podcast is intended for axial spondyloarthritis patients and has been initiated and funded by UCB Pharma Limited. Information contained within this podcast is not intended to be a substitute for consultation with your healthcare professional.
Another really common question that's asked by our patients are, how can their condition be monitored?
So the healthcare professionals involved in your care will regularly monitor the disease activity and response to treatment. So that will be done by using a number of different measures to see how the conditions have an effect on your quality of life. So the most common measure that's used is the BASDAI questionnaire. And alongside that, we also use the spinal VAS measure. So that will be used to monitor the activity of the disease. We'll also review your spinal flexibility and also the effect that your symptoms are having on your daily life. If you're taking the DMARD or biologic medications, then blood tests will be carried out every 3 to 4 months just to ensure that your blood levels are within normal ranges. And obviously, during your consultations, you will also be having a discussion about your general quality of life and how you're managing, as we know the impact that managing a long-term condition can have on the whole of patients' lives. So if there are any other issues that are highlighted during those conversations, then obviously you can be referred on to other services for further management.
So, Diane, you talked about BASDAI and spinal VAS. How do we define active disease, and how do we suggest that they've improved on the basis of a BASDAI and spinal VAS?
So if patients have active disease, then we're looking at them scoring higher numbers on the BASDAI and the VAS scales. That's generally numbers above 4. And then follow-up consultations patients will redo the questionnaires, and we would be looking for those numbers to reduce. And if patients are on biologic medications, then we're looking at those numbers reducing by at least 2 points on both scales.